It is a pleasure that you are with me again. I hope you and your pet are well. Today we will talk about the following. What are the symptoms of gastric torsion in dogs? Let's start. Also known as bloat, twisted stomach, or gastric dilatation, this condition is one of the most serious emergencies in small animal practice, and it can make all the difference in outcome if recognized right away. There are two parts to this condition: swelling and torsion. Bloating is when a dog's stomach fills with gas, fluid, foam, or a mixture of all of these, to a much larger size than normal. Torsion is when the entire stomach is twisted inside the abdomen so that it closes both at the entrance and exit, like a sausage that is twisted at both ends. Both can occur together, or one can lead to the other. If the bloating occurs first, the enlarged stomach is at greater risk of torsion. If twisting occurs first, swelling will definitely occur. No food can leave the stomach, so it ferments and no gas can be expelled. The effect of the swollen stomach is that it puts pressure on all the other vital organs close to it. Breathing will become difficult, and if the large blood vessels within the abdomen are squeezed until they do not allow blood to flow, then other organs will begin to close. The stomach wall and spleen can become necrotic due to loss of blood flow, and this releases toxins into the bloodstream. It is very painful, and if not corrected, the dog will die. The reasons why this condition occurs are not fully understood, but there are some well-known and well-defined risk factors. The condition occurs primarily in larger breeds, particularly those with a deep chest shape such as Great Danes, German Shepherds, Setters, Wolf Dogs, and Boxers, but these are not the only breeds affected. It also occurs more, but not exclusively, in dogs older than 7 years, and is more common in males than females. The risks are increased if the stomach is very full, either with food or water, so a dog that feeds once a day and eats very quickly, or gorges himself, would be at higher risk. Exercising after eating or after a large drink also increases risk. What are the symptoms? The onset of gastric torsion is usually very rapid. The dog may seem quite normal 1 minute, but once the symptoms start, they get worse very quickly. The most common symptoms are restlessness, anxiety, discomfort, followed by pain, arched back, reluctance to lie down, drooling of saliva or foam, attempts to vomit, gagging, with little expectoration, abdomen swollen, often feels hard and feels like a balloon if hit, fast breathing, pale gums and tongue, collapse, possible death. It is vital to get veterinary attention as soon as possible if you suspect swelling or torsion. Occasionally there may be a slower start. This may mean that the stomach has swollen without twisting, but there is still a high risk of twisting occurring, so veterinary advice should be sought. How to prevent gastric torsion in dogs? Be aware of the signs to watch out for. Feed larger dogs 2 to 3 smaller meals a day. Don't let your dog exercise after eating or after a big drink. Try to discourage fast eating by separating competitive dogs at meal times. Try a specially shaped feeding bowl designed for slow eating. Diagnosis and treatment. Diagnosis of the condition can be quite straightforward if a dog shows all the classic symptoms. X-rays may be needed to confirm this. Blood tests will likely be done to determine the severity of the blood changes. These will be treated with intravenous fluids given rapidly and in large volumes. A stomach tube can be passed, but this will not be successful if the stomach has been twisted because the tube will not be able to pass through the obstructed entrance. The vet may decide to decompress the stomach by inserting a needle into the dog's side. The order in which these procedures can be performed will depend on how sick the dog is. Surgery will be needed to untwist the stomach, check for organ damage, and try to prevent it from happening again. Some will need immediate surgery and others will need to be stabilized first to improve their chances of survival. Some dogs may need to have part of their stomach or spleen removed if the damage has been severe. Surgery is very high risk, especially if the dog is already in shock due to the effects on circulation and breathing. Develop your dog's hidden intelligence to eliminate misbehavior and create the well-behaved, obedient pet of your dreams. Hit the instant access button below now. Don't forget to subscribe to the channel, comment, and share the video. Thanks.